I'm really excited to be joined today by Zereda. Hi, Zereda.
Hello, Sharon.
I have pronounced your name correctly, haven't I?
Yeah, that's fine. But Z is fine, or Z.
Z.
Whatever.
Okay.
Whatever's easiest.
I'm really excited about interviewing you because I know that you have a really lovely story of transformation.
Yeah.
Yeah. So would you mind just telling us a little bit about your label, your condition, what it was that you were diagnosed with?
Okay, I was diagnosed when I was 20 with rheumatoid arthritis. But it took a long time to get the diagnosis, like nearly a year, because my GP, who I continually went to, just kept saying that I was suffering from postnatal depression, and actually used the words one day that it's all in your head.
Wow.
Because the way that the pain started and everything, at first I wasn't getting very much swelling or anything, it was just pain, and I got the characteristic of rheumatoid arthritis where you get lots of infections. I was just getting loads of ridiculous things, just getting more and more down, and I was depressed. In the end, I was, although I didn't take anything for depression, I was seriously depressed. And the last I remember going to see the GP, and it was like 5 minutes up the road. It took me an hour to walk there.
Wow.
Because I was just doing little tiny steps. I was in a terrible state, and I went in and I just cried and cried, and I begged him to help me. And I remember very clearly him saying, well, okay, because he tested me for gout. I mean, I was 20 and I didn't drink. I don't know where gout came into it, but that's all he tested me for. And he said, okay, I'll send you to a rheumatologist. And when I got up to leave, he said to me, yes, you are walking a bit like an old woman, aren't you? And so that was that. Then I got quite quickly an appointment to go and see a consultant. And strangely enough, when I hobbled into his office, he took one look at me from the doorway and said, Mrs. Belson, yes, you've got an acute form of arthritis. Come and sit down and we'll find out which one it is. I mean, wow. He knew with one look.
Yeah.
He knew with one look. So, and that's where it took a while. They have to do loads of blood tests and whatever, and they have to take a whole history to work out, because there's over 200 different sorts of arthritis. People don't realise that.
Yeah.
It's not just one or two. So in the end, I got the diagnosis, and I've got to be honest with you, I was really happy to get the diagnosis.
Of course, yeah.
Because it meant basically I wasn't mad. It wasn't all in my head. It was real. Because even my family, I told my family, that the doctor said it was all in my head. So they were going along those lines as well and trying to, come on, you're okay, and go along like that. So I got the diagnosis, and I was asked to go back 2 weeks later. I went back 2 weeks later. By this time, my weight had just plummeted, and I think it was about 6 stone I was down to by then.
Wow.
Not because I wasn't eating. I was eating. I was just so ill. And at that point, they took me in hospital for 5 weeks for intensive physio and rehabilitation. And I've got to say, I cannot fault the care I was given. They were absolutely amazing. They let me take my daughter in with me. They gave me a room on my own. They were just fantastic. I couldn't fault the care I was given. And I could never fault the care I was given from my consultant. He had a terrible bedside manner. He was, it was just terrible. But I trusted him completely. And he always, I don't know if it was because I was young, but if I went I had to go and see the nurse practically every month because I was very ill. And if I needed steroid injection or something, because I would only let him do it because I trusted him, and they're horrible things to have. He would see me almost immediately, regardless of how many other patients he had. So he was fantastic to me, and I honestly couldn't fault any of the nursing staff at all. But I was told there is no cure. That straight from the off, because as soon as I was told this is what you've got, my first question is, okay, well, what do I do about it? Yeah. Well, we can give you, there's drugs that we can use. Okay, well, when will I get better? Well, there's no cure. We can manage it with drugs. And obviously that goes straight in. It hits you. It's like a brick hitting you, God, I'm going to be like this forever. I'm only 20. How can it, I've got to live like this forever. It was horrible. And back then it was, 26, 27 years have passed now. So back then the drugs weren't as good as they are now. There wasn't as many options. So it was a case of just trawling through the small amount they had and hoping that one of them worked.
So how long ago did you discover EFT, Matrix Reimprinting?
Literally very recently. It's about a year. About a year. So it was April last year that I went on my first course. And
how were you when you went on that first course? How were you physically and emotionally?
I was reasonably well, but I had pain every day, but I was functioning okay. Not like in the old days, but I took painkillers all through the day, to get me through, and anti-inflammatories, and there's a whole host of things that you need to do to manage an illness. If I got tired, I needed to rest. It just becomes a way of life when you've got so used to something. You know the signs. I had my left hand I used to call my canary in the cage, like they used to use a canary to go down a mine. If my left hand swelled up, I knew, okay, that's it. You've done too much. You need to go and lay down. So I was much better than I was when I was seriously ill, but I was still, lots of drugs, painkillers to get me through the day,
Wonderful.
Yeah, all that sort of thing.
So we're now a year on.
Yeah.
And you've been doing regular sessions?
Yeah. Well, I've done, I repeated the course with Carl. I did my first course in Brighton and fell apart. I'm not sure if that's a course or Carl. Who knows?
He has that effect on some people.
So, so I did that one. And then I repeated in September, of course, and I'd already got quite a bit better. But in the last, since September, really, since I repeated, I've just got better and better. I went to see my consultant, I annoyed her actually, by basically saying, look, I'm so much better now. I want to come off my medication. She was really quite cross because in her mind, it's the drugs that have got me better, even though I've been on the same drugs for 15 years.
Yeah.
And suddenly in the last so many months, suddenly I've made this amazing transformation. So I didn't handle that very well because I think it is important to keep your doctors on side. So I said to her, I want to come off. She said, well, I'll have a meeting with it. And she was clearly upset with me. But she rang me a couple of days later and said that she'd had this meeting. And I apologised to her for, being a bit gung-ho. And between us, we agreed that my scans, the previous scans I'd had showed the disease was still active. Mm-hmm. So that we were going to repeat them in October this year. And if they were clear, she would agree to me having a drug holiday. So that's how she describes it. She can call it whatever she likes. I don't mind. So, but then I will have her on side.
Yes.
But I am now on no painkillers, no anti-inflammatories. I'm on the absolutely lowest dose I can be on. You have to be on one to be on the other. So I have an infusion every 8 weeks, and then I inject myself once a week. And that has gone from the highest dose that I was on to the very lowest dose you can be on.
Wow.
So
that's since September 2016, and we're now April 2017, and then in October 2017 you'll have another
scans.
scan.
Yeah, and I mean, I don't know what I will do if they say, oh, the disease is stacked. I just don't know. You'll knock me down with a feather. I don't know what anyone will do with me, because I'll just have to play that by ear. But that was the agreement that I had, and that is what.
Yeah, but you know how you feel, Zereda. Yeah. You know how different you feel to how you feel before. And didn't you recently just go and see a nurse?
Yeah, just the on Thursday. Was it Thursday? Yeah, I think it was Thursday morning. It was a new nurse. I've never seen her before. And she was visibly shocked when I walked in, because she'd been going through my notes, and because she'd never, she didn't, what my notes said, obviously she was expecting something else. She was like, oh. So I sat down and I just started telling her what had been happening. I was on she didn't realise I'd gone on to the lowest dose. She thought I was on one higher. Mm-hmm. And I said, no, I've been fine. And I told her all about EFT and Matrix and all what I'm doing. And she was just really, really interested in it and really amazed. Because I said to her, the belief that I had was that there is no cure. I said, that is the belief. I said, and I've had to do a lot of work, personal work on that to try and change that belief, because you believe what doctors say and you believe what nurses say. You put your life in their hands. And she said, do you know what, Zereda? She said, you've really made me question what I say to my patients. I'm going to be more mindful in future. And I said, well, thank you. And I was really pleased, but I didn't realise. I then put that on Facebook on the page, but I didn't expect it to have the reaction it has had, because I didn't think it was, it made me feel good that she said that, but I didn't think of it the way other people have thought, that that's going to have a ripple effect on everyone else. So thank you to everyone that made me aware of that. It's really great, and I hope it does. She also, which I didn't put on the Facebook thing, she also asked me to go and do a talk with some patients about complementary therapies, which I said, well, I'll have a think about it, but I probably will. But what I really want to do is talk to the doctors. But maybe I'll start with the patients first.
Start with the patients, and then the doctors will start listening if their patients start to get better. Yeah,
hopefully. The patients have asked, in this particular group, have asked for complementary or alternative therapies. So, they're obviously open to things. The reason I hesitated was, the big thing for me on that first course was realising that my illness had become my identity. Yeah. And that was a massive thing. I just did not realise. I used to tell people I had rheumatoid arthritis practically before I told them my name. Because I didn't have it. I just didn't, for so many years, I had nothing else in my life. I was a wife and a mother, and that was really important to me. But when people saw me and I was hobbling along, they instantly, I've had people shout at me because they assumed I was deaf. So I would just sort of get it out there so it was done, but it did become my identity. And that's sad.
It is, but you've now got a new identity.
Yes, I have.
Wonderful. So, in the work that you've been doing with Matrix Reimprinting, have you actually found the root cause?
Yes, I have. It's a bit strange.
Okay.
So you need to be open to this. I got in touch with the lovely Penny Kroll, who's a mental health person.
Yeah.
And she very kindly gave me a 20-minute free consultation. And when I said to her, you know, I'm pretty certain it started the night my daughter was born. And she said, okay, I want you to tell me what happened to your mum 7 years before you were born. And I thought, well, that's a bit odd. So I said, okay. And I immediately thought that my mum had lost a child 5 years before I was born. She had a stillbirth. So I immediately thought, oh, well, that's what she's talking. And she said, no. 7 years. It was so specific. Don't ask me how she got there. So I thought about it, and I said, oh, actually, yeah, my mum was pregnant with twins, and the love of her life, her first husband, she found out that he was leaving her for another woman. And she actually later told me that she'd fainted when she found out.
Wow.
It was such a shock to her. And Penny said, yes, that's it. That's the moment. So I've been done quite a lot of work with Sue Woodruff, who Penny recommended to me. And so we've visited me as that little egg there. And yeah, really pretty profound sessions we've had around that. I would never have known that that's where it came from. But Penny, you know, it was obviously connected to me giving birth. So yes. It went back, you know, there was something about that. How she ever got to know that something had happened, so I've got no idea. You'd have to ask her. It's
well,
like
maybe
magic.
I'll interview her and find out.
Yeah, interview her. I've got no idea. But yeah, and I've just spoken to Sue today, actually, and just explained to her that since I've done 5 sessions with her now. I'm going to have some more. I did a block of 5. And my main problems were with my shoulders. They would just go if I lifted up something too heavy, even though I've been quite well. And since those sessions, I haven't had that happen at all.
Wow.
Because before, when they go, I have to put my arm in a sling and not use it for 24, 48 hours. It's the only way to get it better. And I'm actually like, if I do something now, I'm actually waiting for it to happen. And it doesn't happen. It's amazing. So I know things are changing. So my next thing to work on, which is going to be interesting to see if it can work, is my hands are quite damaged from the arthritis. So
just hold them to the camera for us, so we can see those, and then we'll do this interview again in a number of months' time. And see how they are.
They're not too bad, but I've got you can't really see it. I've got bits that just aren't right. They're not too bad because there's no swelling there now. They don't look nearly so bad, you know. But they're knobbly and whatever. So I've asked Sue if she'll do some specific work on seeing if we can change that. Who knows?
Do you have, how much mobility do you have?
I mean, they work, but they sort of all cross over. I haven't got much movement in my wrists, but because I wore my splints 24 hours a day, because I was advised to, I haven't got a dip, because they if you don't, they dip. So they've kind of fused, but in a helpful position. So I was a very good patient. I always did what I was told. Well, 95% of the time I did what I was told. So, and that's why, because I always exercise, I had hydrotherapy 3 times a week for years. And that's why I'm not too deformed. So if anyone's out there that's got that kind of illness, you do need to exercise every day. And I will always do, you know, my stretches and whatever. It's nothing big. It's just putting your joints through the full range of movement. And that's really important.
Wonderful. And now, Zereda, you're actually working with clients, helping them. Is there any specific area that you specialise in, or are you just still at that stage where you'll work with anybody? Yeah, I'll just work with
anybody and so see what comes up. So anything really, all sorts of things. I'm just open to whether I'll ever niche or not. I don't know, but at the moment I'm just whatever comes to me. Yeah, let's give it a go.
Excellent. And I know that you're still quite a new practitioner, so if people want to find you, then they can find you through Facebook.
Yeah, at the moment, I haven't got a website set up yet. I've got someone that's going to help me with that soon. Beautiful. So
they should be able to find you quite easily on Facebook because your name is quite unusual. Yeah.
I mean, to be honest with you, there are a few Zeredas, but most of them are in America. A lot of them are men.
Right.
So I'm Zereda Belson. I think there's only one of them listed. So
Beautiful.
They can find me through that.
Zereda, thank you so much for spending this time with us today, sharing your amazing story, and I can't wait to speak to you again in October and just see where we are and what's happened since April. So
I was thinking about maybe getting well enough to learn to pole dance or something, you know. So you can watch it. I'll do a 12 for you, round one or something.
Brilliant. Yeah, that means you do have to buy a pole to have in your room.
Yeah. Okay. All right. Thanks so much, Sharon.
You're welcome, darling. Thank you.